Hello, this is Janet Michael. In addition to hosting the Valley Today each weekday at noon on the River 95.3, I also produce podcasts, and I'm excited to introduce you to a new podcast series in partnership with Lord Fairfax Community College. Having provided higher education and career training for the past half-century, LFCC is tightly interwoven into the fabric of the Northern Shenandoah Valley and Piedmont regions. Join me every week for conversations with current and former students to hear their funny and inspiring stories as we learn about their journey to higher education, the role that LFCC has played, where they are now, and where they plan to go. We'll also talk to current and former professors about their experiences and best memories of LFCC over the past 50 years. Get every single episode as they're released on our website at theriver953.com under the podcast tab, or you can subscribe for free in Apple Podcast, Google Podcast, on Spotify, Amazon Music, wherever you listen to podcasts. Just search for LFCC Stories. Hello, and welcome to the Valley Today. I am your host, Janet Michael. Happy Thursday as you are listening to the show today. It is the third Thursday of the month. That means we are talking community health, and I think today we are talking more community health than we have in episodes in the past because we're not focused on a singular topic. We are focused on all of the aspects of being healthy. I'm excited. I've got Mike Wade on the Zoom screen with me pre-recording our conversation today. He is the chair of the virtual health fair that Valley Health is putting on starting this Saturday, March 20th. It's going to run through Saturday, March 27th. And Mike, I'm kind of excited. We were chatting a little bit before we started recording for the show. I'm glad that you guys figured out a way to still have this health fair, even as we're still in the throes of this pandemic.
Yeah, we're really excited to be able to offer it as well. It would have been easy to just say because of the pandemic, this year we can't hold the health fairs, but we've tried to come up with a way to offer a lot of the same things and information, but virtually, or at least in as far as the in-person screenings, in a safe, controlled way. So we're excited to be able to offer it this year.
And this is going to be kind of a combination between the one that you normally do in late February at the Apple Blossom Mall and the one that you would normally do coming up in April at, I think you have it at Warren County High School for the Warren County Community Safety Wellness Fair. So you're kind of combining the two of them into this 1 week?
That's correct. I mean, the beauty of a virtual event is, first of all, it's easy to extend it to multiple days rather than just 4 hours, and you're also able to expand it. So beyond those two events that were obviously Front Royal and Warren County focused and Winchester focused, the virtual health fair really can reach people all across our region and give them an opportunity kind of for a virtual checkup. And so we were excited kind of that's even an exciting switch to expand it that way.
How much work was it on the back end to be able to put something like this together? I've talked to a lot of small business owners, a lot of nonprofits who have talked about the pivot to online and virtual things, offering services and products. This had to have been quite a huge undertaking to turn this whole thing virtual, wasn't it?
So, well, I think it has been a lot of work and a lot of good work, and there's fortunately, a lot of people involved. A lot of our partners from past years are continuing to assist Shenandoah universities, their School of Pharmacy, their School of Nursing are both participating. And so we've had a lot of support in that. Really, the beauty of a virtual approach is we've been able to tell people kind of think creatively and think big, and we've tried to work out those challenges as they've come up.
I think it's going to give you an even broader audience. I mean, you touched on this a minute ago, but it's going to make it so much easier for somebody who maybe has kids that had other activities going on. I know in years past, sometimes a Saturday is a tough day to squeeze out some time to come to something like this. And now people are going to be able to do it on a Tuesday afternoon or a Thursday morning.
Right. Mm-hmm. Just one kind of good example is both of the health fairs in the past have offered reduced cost blood work during those days. There were just 2 days, and now it's available all week long at Valley Health Lab locations across the region. So it really makes it simple and potentially makes it available to more people than we ever have before. So that's exciting.
So is something different going to be available every day? Is it going to be the same thing at the same time every day of the week? How does it look from a calendar perspective?
There's really two components to the health fair. There's the in-person screenings, and then there's the virtual programming, we're calling it. And really, we've tried to offer virtual programming largely 9 to 5, almost every day, Monday through Friday of the week. And really, people will need to go on to the website, valleyhealthlink.com/health fair, and there's an opportunity there to check out the schedule, and it provides the links to the programming. And for example, there's a live fitness class every day at 9 a.m. And so that's something that's consistent Monday through Friday. They can, and that's another example of something, in the past, we've offered fitness demos at the mall, and at times encouraged people standing there to participate. I don't know about other people, but I might be hesitant to, try it out in the mall setting. But hey, in the comfort of my home, I'm watching it live there. I may try my kickboxing. I know the Monday class is kickboxing. I sense that's not something I would have done in the mall.
Well, and I would imagine too that it's going to be easier to get answers to your questions because it's not in person. You don't have to wait in line necessarily.
Right. I think there is, I do just want to be clear. There are some events that, some of that programming that is, even though it's virtual, it's live, meaning there is a facilitator, a presenter who will be answering questions. There's other programs where it may be a new presentation that's being kind of premiered, if you will, with then instructions for follow-up. And so it's not always that there's going to be a live facilitator there answering the questions, but in many cases there will be.
Now, is there a registration process or do people just show up on a particular day to see what's going on?
Okay. For the virtual programming, that is just a situation that they can go to the website. There's a page there that has links to the program. So if they find a program they're interested in hearing about, such as 10 warning signs of Alzheimer's, there will be a link there. They click on the link, and at the time the program starts, and they'll be able to access the program directly. So there's no pre-registration available, or required rather. For the in-person screenings, all of those do require pre-registration. And again, that's a way to assure that they're being handled in a safe manner because of COVID. People have an appointment to show up, and so they're not standing in line.
For the virtual programming, will some of that still be available even after this week passes? Because I would imagine it would be fairly easy to record some of it and people can go back later and catch it if they missed it during that week.
Right. Much of it will be available. Much of it, not entirely sure that's the correct, at least a portion of it will be available actually all week long. So for example, if there is a presentation on a particular topic that has been taped in advance, we're going to have a link to that on the website all week long. And there is actually a page on the website that has a wide range of health and wellness videos. So there's resources that people can check out and watch at any point. And we will be adding those new presentations there as well.
So you mentioned the in-person blood work and heart opportunities to get heart checks, to get EKGs, to get your blood work done. Is that going to be very similar to how it has been in the past, except that you're going to go directly to those hospitals and get that work done? Have you expanded the opportunity and the offerings that you guys are going to have this year because it's virtual?
It's really very similar in terms of the screenings that are available, but we have expanded the locations. For example, the Valley Health's Heart Attack Risk Program typically would have been at the mall and the high school those days of the health fair. Now the Heart Attack Risk Program is taking place at 7 locations, a different location each day during the week, 7 out of the 8 days. And that information's on the website, and they're at locations across the region, some in our West Virginia service area, several here in Winchester, and then in other locations, of course, in Front Royal and all throughout the region. So that's an example of what would have been just 2 limited screenings now is 7 locations. And so again, expanding the operations or the availability, the accessibility.
And I know you offer the reduced cost blood work vouchers, which are great because typically that's an expensive thing, insurance or no insurance, to have done. And people can go on the website and purchase, I guess, one of those to have their blood work taken care of.
Actually, we do not have the ability to purchase them on the website. That would have been great. We haven't been able to operationalize that at this point. There are outpatient lab patient service centers across the region, and people would need to stop in there or call them to make arrangements to purchase them, the vouchers. And then the vouchers are good through July 1st. So it's not that you just need your blood work this week to get done. If you're anticipating that you're someone that maybe gets it checked twice a year and you're not due till June, it's an opportunity to purchase the voucher now at a reduced cost. And I'll just mention the cost is even lower this year than it has been in past years. We've been able to reduce the price even further, so we're excited about that.
So we're going to go to a quick commercial break. Before we do, can you tell me again real quick, where can people get more information about all of the things that are happening at the virtual health fair?
It's website valleyhealthlink.com/health fair. We try to make it simple there. So.
Yeah, you can't get much easier than that.
Right.
Well, we are going to take a quick break. When we come back, we're going to continue our conversation with Mike Wade. He is the chair of Valley Health's virtual health fair. It is happening this year online Saturday, March 20th through Saturday, March 27th. When we come back, we're going to talk with him more about some of the virtual programming that they will be offering. So hang in there. We'll be back in just a couple of minutes.
Got a financial decision to make or a goal to reach, but you don't know where to start? You've come to the right place. Introducing Quick Money Chats with the Northern Shenandoah Valley Financial Education Program. Visit tinyurl.com/Quick Money Chat to schedule a virtual chat with a staff member or trained volunteer. We won't tell you what to do, but we will give you the tools you need to choose wisely. And because Virginia Cooperative Extension is part of Virginia Tech and Virginia State, your land-grant universities, you can be sure that our information is credible and trustworthy. And you'll know that we aren't trying to sell you something. Maybe you want to improve your credit score, or reduce your banking overdraft fees, or even figure out if you can afford to buy that car. Sorting through tons of information on the internet can be overwhelming, and sometimes it can be hard to know who to trust. Schedule a Quick Money Chat and get the information you need to take action. Go to tinyurl.com/Quick Money Chat and get financial education personalized for you.
Welcome back to the Valley today. I am your host, Janet Michael. Happy Thursday. As you are listening to the show today, it is our Community Health Partnership Day. So I am on the Zoom screen pre-recording my conversation with Mike Wade. He is the chair of Valley Health's virtual health fair. That's right. It has gone totally virtual this year, with some exceptions, I guess we should say, Mike, because nothing really can ever be completely virtual. There is still the opportunity for the in-person blood work and heart EKG tests and things like that. So you haven't gone completely online, right?
Right. Now, of course, the screens, some things like drawing your blood, at least yet, isn't something that can be done virtual. So that testing's offered in person. The heart attack risk program, which is again testing a blood using a blood stick to then measure your heart attack risk, and it involves a consultation with a nurse. That's in person. There seems to be a theme here because I'll mention there's a blood drive at Apple Blossom Mall on the 24th as well. And again, if you're donating blood, that has to be done in person as well. And then you've also, of course, mentioned the cardiovascular screenings. And there's the carotid CIMT screening, which is done, again, obviously in person, as well as a 12-lead EKG baseline screening that's done. And that's being done at the Winchester Medical Center Conference Center on Saturday, March 20th. and they're in person. And again, you need to pre-register in advance, and that information is available on the website.
And I think it's great too because, we touched on this earlier that typically you have one of these health fairs at Apple Blossom Mall in February. You have another health and wellness safety expo in Warren County in mid-April. But because you're taking this online, you can get these risk screenings at 7 different regional facilities. So somebody from Luray doesn't have to drive to Front Royal on that particular day to get that screening. Everyone in your community can now go wherever and schedule them themselves.
That's correct. As you said, instead of just 2 locations, the heart attack risk program is being offered across the region at locations and multiple locations. And again, I hate to keep pointing people back to the website, but the details there are there, and the number where they can call to register for those screenings.
And then online programming, the virtual stuff, you guys have really kind of got it laid out pretty easy for somebody to figure out, well, this is the one thing, say I'm interested in fitness, or I'm interested in CPR, or I want to know something about diabetes. It's all kind of laid out calendar style so that people can figure out what time and what day they need to be where.
We've really kind of went with the idea of kind of hour-long segments. Not that each program takes an hour, but just at the top of the hour, there's a new virtual health fair segment, virtual programming that's beginning. We've mentioned the daily fitness classes at 9 a.m. Later on in the morning, we'll have an Ask the Healthcare Professional segment. So on that day, there'll be an opportunity. One day you can talk to a physician, another day a nurse practitioner, another day a physical trainer or a physical therapist, and I believe a massage therapist is another one of the categories that you can talk with. So it's an opportunity to ask your questions and just engage with someone in a really easy, convenient manner. I mean, I guess virtual, it's all about being convenient as well, because you're not driving somewhere, you're doing it from home or from your office. And so you're able to, it's really kind of makes it convenient for people to just get some questions answered. And then the rest of the day, there's various segments on quite a range of topics, ranging from diabetes, you mentioned, CPR, we're going to be offering, and again, this is an example of something that was done live in past years, but we'll have the Revive opioid rescuer training, and which is an important thing. I think we've all heard about the increased overdose and taking place as a result or during the COVID pandemic. So it's great to be offering that training still. I'll also just want to point out, we're going to have a community COVID update. So if people would like to kind of hear the latest on where our community's response to COVID stands and the vaccine situation availability, that'll be Wednesday, the 24th at 4 p.m. And Dr. Colin Green from the health department will be leading that update. So we encourage people to check in there. I'll just point out all these programs are listed, as you mentioned, on the website, kind of by day and by hour. And for each one, there's a link provided, whether it's to the Facebook Live event or a Zoom meeting link that people can click on and just access the presentation, the programming.
And you haven't left out the kids either, because I know that kids activities was an important piece of both of the in-person wellness fairs that you've done in the past.
Yeah, we once again this year, similar to kind of at the in-person events, we do have a kids zone, and we have some information that's on kind of healthy habits, nutrition for kids, and also some safety information such as bicycle helmet safety. And there's some activity sheets and opportunities for kids to take the safety pledge, complete the activity sheet, and then submit it to be entered into either a drawing for a free bicycle, or everyone can get a Valley Health 95210 t-shirt for doing that. And the 95210 refers to healthy habits, like 9 hours of sleep, and 5 fruits and vegetables a day. And so all that information's there on the website as well.
That might be the thing, because I'm one of those people, but that might be the thing that I miss the most about not having them in person. Because I know a lot of people are like, oh, I can't wait to like see people face to face and be able to, shake hands, if that's even still going to be a thing. I miss all the cool swag and all of the clips for my refrigerator and all of the stuff that I'm not going to be able to get this year.
Yeah. I'm sorry we didn't figure out how to get the swag to you virtually, but I can definitely relate to missing my health fair friends that I won't see in person this year that I've typically seen every year.
Yeah, the last couple of years, I've been to the one in Warren County. Typically, the station does a live broadcast that day. So I always go and help Lonnie get everything set up. And I always joke that it's as sad as it sounds, it's one of the days of the year when my Fitbit sends me a notification that it thinks it's been stolen, because I've gotten so many steps that day from running around and talking to people, which is ironic considering I'm at a health and wellness fair.
Well, at least we're improving the health and wellness of those who attend, even if it's just by walking.
Right? So I know we mentioned it a couple of times. I don't think we can mention it enough so that people know where to go. So the best first place to get all of the information, to find out how they register for the in-person blood work stuff, to find out where the calendar is for the different virtual programming that's going on, where should they start?
Okay. Obviously, there will be a lot of information that's pushed out on the Valley Health Facebook and social media accounts over the coming week and during the health fair. But really, the go-to place is the website, valleyhealthlink.com/health fair. And there's multiple pages there, a lot of information for people to check out. And, that's where I'd point people to go to.
And it starts this Saturday and runs through next Saturday, the March 20th through the 27th.
That's correct. Yep.
Fantastic. Well, Mike, thank you so much for taking some time out of your day to give me the scoop and the rundown on everything that's going on. I appreciate it.
So, well, I appreciate the chance to talk with you. So
we are going to wrap up our conversation today. We have been chatting with Mike Wade. He is the chair of Valley Health's virtual health fair. Again, it starts this Saturday, March 20th, and will run through Saturday, March 27th. valleyhealthlink.com/health fair is where you can get all the information. I, of course, will put that link in the show notes page as well. Tomorrow, it is Extension Office Friday, and I have already had my conversation with Karen Poff from the Warren County office of the Extension. We're going to be talking about a new program that she's offering called Quick Money Chats. So much like the virtual programming for Valley Health and figuring out how to get yourself healthy, Karen is going to have a new program that lets you ask money questions about raising your credit score, about buying a new car, and interest rates. So meet me back here tomorrow. She will give you all of the details for that just a few minutes after noon.